Blood pressure demonstration. Before the assessment, patients should not ingest caffeine and nicotine. Patients need to be seated. Patient's back should be well supported against a surface. Feet on the floor, make sure they are not crossed. The patient should maintain that position for 5 minutes before taking blood pressure. The proper arm placement should be the left arm placed on a flat surface at patient's heart level with palm facing up. To check the proper cuff size, look up in the inside part or cuff. If it falls under the first line, you need a smaller cuff. And if it falls after the second line, you will need a larger cuff. The proper size should be in between. Stethoscope instructions. Prongs should face away from you. The diaphragm should be placed on the inside part of the left arm on the brachial artery in using your middle and index finger. Measurement should be taken on bare arm. Place cuff around left arm and put the artery mark on top of the brachial artery and make sure the cuff is secure. Make sure the valve is closed before pumping with the valve. To close it, turn it all the way to the right. With the valve, inflate the cuff to 180 millimeters of mercury. Then turn the valve slightly to the left to release the pressure at a rate of 2 to 5 millimeters of mercury per second. You should hear a tapping sound. The first is known as systolic pressure, and the last tapping sound is diastolic pressure. These sounds are known as Karatkov sounds. These are the steps to measure blood pressure. Blood pressure classification. Units would be in millimeters of mercury. Normal pressure less than 120 for systolic and less than 80 on diastolic. Prehypertension is 120 to 139 in systolic or 80 to 89 in diastolic. Stage 1 hypertension is 140 to 159 in systolic or 90 to 99 in diastolic. Stage 2 hypertension higher or equal to 160 for systolic or higher or equal to 100 in diastolic.